Hello and welcome to Chapter 1, Introduction to the Emergency Medical Care for the EMT. So we're going to take a look at the emergency medical systems, the components of the EMS system, research, and special issues. The emergency medical systems. So in the 1790s with the Napoleonic War, it kind of began with Napoleon and his chief surgeon. It really kind of started there. The chief surgeon was like, "There's too many people dying on the battlefield. We've got to take medical care to them on the battlefield," and that's kind of where EMS started. In the Civil War, the American Red Cross began, and they started really more so taking that medical care to the wounded on the battlefield. And then we have World War I with the Volunteer Ambulance Corps, and then the Korean and Vietnam conflict with MASH type units and helicopter transport from the battlefield. If you really want to get an idea of how that was, I'm sure you've all seen MASH. That's pretty much where that comes from. So non-military ambulances began operating in the early 1900s. They were operated by hospitals, fire departments, funeral homes, and there were no requirements or standards for equipment, crew training, or ambulance design. In 1966, there came a paper saying, "Hey, there's too many deaths on the highway." So the government charged the Department of Transportation with developing some type of standard for safety on the highway. Part of that standard was EMS, and really kind of setting that standard was their responsibility. In 1970, they founded the National Registry of EMTs, which is where all of our registration comes from. Basically, it's a company that says, you've been taught to the standard. We recognize that you've been taught to the standard, and you can practice at this standard. In 1973, the National Emergency Medical Service Systems Act was passed by Congress. So NHTSA standards for EMS systems. There's about 7 or 8 things that go into this. And we're going to take a look at them. So regulation and policy. This establishes that each state has laws, policies, and regulations for EMS. And then resource management. It's centralized coordination of emergency treatment and transport resources. So human resources and training. This is to ensure that EMS personnel are trained and certified to minimum standards. So we have the class that you're going through now, you have minimum standards that I have to teach you to. I will more than likely, because I am invested in this and invested in your class and your training, that we will exceed those standards, because some of those standards are archaic in my opinion. Transportation, is to provide safe and reliable transportation. So those standards are on the ambulance. What goes into an ambulance, what makes it an ambulance, and how that goes. Facilities, transport to the closest appropriate facility. So there are different types of facilities. Here in Missouri, we have level 1, 2, 3, 4 trauma centers. And here where we are at the lake, we have Lake Regional, which is a level 3 trauma center, and our closest trauma 1 centers are Springfield and Columbia. So it just kind of depends. That's where it was born out of, but you know, they've taken it to new levels, where we have stroke centers, we have cardiac centers, we have sepsis centers, because all of those things are time critical diagnoses. And when we look at those things and we decide, we're trying to figure out where we're going to take our patient, just kind of depends on what is wrong with our patient and how they need to be helped. And then communications, the universal access number 911. Of course, it goes into dispatch to ambulance, ambulance to ambulance, ambulance to hospital, and hospital to hospital communications. So there's a what we call the HERE channel here in Missouri that makes us, or allows us to speak from the hospital, from the ambulance to the hospital, or you know, if we're on scene, we have that ability to be able to talk to the hospital. And then public information and education. We educate the public about the role of EMS, access to EMS, participate in injury prevention programs as well. I think that's something that has been lacking. You know, educating the public about the role of EMS. It's just something that, you know, most people don't realize that there are, you know, 3 or 4 levels in some states of EMS personnel. You know, in Canada, they call all of their paramedics paramedics. Doesn't matter what level you are. In their title is where it kind of sets the difference between a advanced care paramedic and a primary care paramedic. But it's still a paramedic. And that primary care paramedic is that EMT level, advanced EMT level type role. So, you know, they do a great job of educating. They're all paramedics. They're in title. But then, you know, once it gets down to it, then they really kind of control that distinction. Whereas here in the States, we talk about EMTs and we talk about paramedics and we talk about advanced paramedics and community paramedics. You know, we don't have, like, we're all rolled into that EMT thing. You know, even the Bureau of Labor Statistics can't really define and differentiate between the two. So when you see their statistics based on, you know, the salary ranges and everything, takes into the EMTs consideration as well as the paramedics, and they're so, it's such a broad role and different role that you really can't take both of those into consideration together. And then, of course, medical direction. The medical director is accountable for EMS personnel within the system. You work under the medical director's license, and so what he says goes. And he along with management, create a set of protocols for you to follow. And then we've got trauma systems, which is to develop trauma triage, transport, and treatment protocols. Really, that's the standard. You know, when this was created, it was created back in, you know, 1966, to deal with the trauma that was happening on the highways. with the increase of vehicles being on the highways and the development of, interstates and byways and, all of those things. Um, it was really developed there, so they placed a heavy focus on trauma systems. Now, today, we've grown into much more than just trauma. We treat a wide range of medical problems. And then evaluation. Established the program for evaluating and improving effectiveness. QI, which is quality improvement, QA, which is quality assurance, and TQM, which is training quality management. So all of those things have to go into a program to, evaluate that program and make it better. So we've got some other specialized care facilities. We've got trauma centers, burn centers, pediatric centers, cardiac centers, stroke centers. Again, I talked about it a little bit before, where they all have like different types of levels of those deals, those specialized facilities. So here recently we've added in sepsis centers, where sepsis is a time critical diagnosis, and we'll talk about that a little bit further on. But yeah, when we talk about those things, we talk about those trauma centers, burn centers, pediatric centers. We've got trauma centers. Most hospitals are designated as some type of trauma center, whether it be a level 1, level 2, level 3, level 4, and the different levels just basically state what kind of services they have, as far as treating those patients and how they're treated. So just something to think about. What medical services are available in your community? How important is it that EMS personnel know the capabilities of community medical facilities, and what are the possible consequences of transporting a patient to a facility not equipped to handle a problem? So when we talk about here in Missouri or here at the lake, we've got the level 3 trauma center here at the lake. They're also a stroke center, a cardiac center, and a sepsis center. So all three of those, the sepsis, the stroke, the cardiac, we can take our patients to the lake and it'd be fine. Now, the trauma center, we can take our patients to the level 3 trauma center to get them stabilized, and then they get transferred out. So, for us, it's great, but sometimes those patients need that level 1 trauma center at the very beginning. So they need to be, especially here because we're an hour and a half away from a level 1 trauma center, they have to be flown out typically. So accessing the EMS system. So how do we access that EMS system? If you've never called 911 before, you really don't know. But you have a patient, somebody calls 911, they talk to the dispatcher then dispatches the EMRs, the fire department typically, or PD, and then the EMTs arrive on the ambulance. We take them to the hospital where they have the emergency department staff, and then further care with the allied health staff like radiology and respiratory therapy and various things like that. So again, 911 telephone access is available in most communities. I do know that like when you get out west, let's say Montana, Colorado, those bigger states, they do not have 911, and there's a specific emergency phone number that they have to call when they need something. And then we have Enhanced 911 now, which provides the caller number and location for landline phones. Our dispatchers provide instructions to the callers on how to provide emergency care until EMS gets there, and then they have some type of certification. So critical decision making is a very important concept in EMS. We have to gather the information, we have to assess our patient, and then we determine how treatment and transport is based on that information and the assessment. And sometimes these decisions are often time critical, like traumas, stroke, sepsis, cardiac. All those are time critical diagnoses. And when I talk about time critical diagnoses, like in trauma, there's an hour, the golden hour, to save that patient in a severe trauma, multi-system trauma. When we talk about cardiac, there's only so much time for that heart to be able to fix itself or have some type of intervention in order to fix it. That it's a time critical diagnosis. Same with stroke. When a patient's having a stroke, a blood clot, we can give medication called TPA. That TPA is a time critical thing. It can only be given within so much time. And sepsis is another time critical diagnosis where you have to get that patient started treatment and early treatment in order for that patient to have a good outcome. So some examples of critical decision making or critical decisions. So is it better to take the patient to the closest hospital or to the one farther away but more appropriate for the condition? It depends on the patient assessment. It really does. So you have to have a good patient assessment and really know your resources around you. So if you're going to take your patient to the closest hospital, like here, like I said before, we could take trauma patients to our level 3 trauma center and then transfer them out. That is just to kind of get them stabilized a little bit better for the drive up there. So like they're very critical, but they need to be taken to that level 1 trauma center. And it depends on, if you've got helicopters flying or if you don't. So, there's a lot of variables. Okay. So is the patient stable enough for further evaluation on scene, or should the patient be transported immediately? So when we talk about this, when we get into like chapter 11 of the scene size up, 12 of the primary assessment, when we look at that, we're going to determine rather quickly whether or not our patient is stable for what we call stay and play, or if they are too critical and they need to load and go. And those two differentiations are what we need to make in order to get our patient treated appropriately. So will this patient treatment make the patient better or worse? So we've got to take those into considerations as well. And we've got to look at, if I, stabilize my patient and stabilize a broken leg on scene, did I make it better by staying on scene and stabilizing that leg? Or did I make it worse by staying on scene and stabilizing that leg? Where instead I could have been en route to the hospital and not stabilized that leg and not done anything. And we'll take a look at that further down, trying to figure out if we're going to, that's one of those stay and play or load and go type deals. So in EMS, there are different levels of training. Um, we have the EMR, which is the emergency medical responder, the EMT, which is the EMT basic, um, and then we have the advanced EMT, which is kind of in that level between the paramedic and the EMT. If you've been around EMS or fire or anything like that, not necessarily in Missouri, but in other states, there are what they call EMTIs or intermediates. National Registry here recently, in like 2015-16, decided that they had too many different levels of EMT. So they used to certify EMTI, which was based on the 85 curriculum, and then they used to certify EMTIs at the 90. So they were like basically I-95, sorry. So in 95, there was a new curriculum that came out, and so people were still teaching at both curriculums. So in some states you'd be I-85, and then in other states you'd be I-95. So National Registry is actually testing for both, and then they decided, hey, this is crazy. We just need like 3 levels and 4 levels, and we're good. So they cut the I-85 and 95 down, and they created this advanced EMT. So this advanced EMT can do some things. They can start IVs, which is the big thing, and give some certain medications. Not as many as the paramedic can. So there's, the paramedic can obviously do lots more. They can give a lot more medications. They can read the monitor, treat the patient based on the monitor, and various things like that. So roles and responsibilities of the EMT. Personal safety, safety of the crew, patient and bystanders, patient assessment, patient care, lifting and moving, transport, transfer of care, and patient advocacy. All of those things go into what we do on a daily basis. Patient assessment is your biggest ally and tool. So you really need to be able to do a good, thorough patient assessment. So let's think about some things. How would it impact an older patient, if they were transported to the hospital without glasses, hearing aid, or dentures? Those older patients feel, that if we were to transport them without their glasses or hearing aid or dentures, they wouldn't be able to see, speak, or hear. So they've got to have those things. So just taking the time to get those things, or making sure that those things got to the hospital, is important. And it goes a long way for the patient, and for the patient to feel comfortable. So on a routine call, what would taking the time to gather these things have a negative impact on the patient's care? No. On a routine call, it wouldn't. Grandma and grandpa, they've fallen, or they were having some abdominal pain or something like that. Any of those things, it's not that big of a deal. You can take the 2 seconds it takes to get those things, because again, you getting the time to take those things and making sure that the patient has those is it goes a long way for patient care. Okay. So how about assuring the home is secure and locked before leaving? We can make sure that this is 2 seconds, making sure that they have a locked door and that they have their keys. Not that big of a deal again. Okay. And it goes a long way to help your patient. So could the concept of patient advocacy also extend to the community? Fall prevention programs for the elderly, poisoning awareness, pool and water safety programs for children. Absolutely. I mean, yeah, we do those things, okay? So when I go into a home and it's for like a lift assist, where all we're doing is we're just going in there for that lift assist. I do some patient education, not just for the patient, but for the family that's there too, if they've got any. So I'll go in and I'll be like, make suggestions on, you know, what to clean up, how to help prevent those falls, um, and do things like that. All of those things are great for the community, and it helps us and it helps the patient as well, so that they don't get re-injured, and you know, um, and they're calling every day. So, what are some physical traits of a good EMT? So, you have to have the ability to lift and carry equipment and patients of up to 125 pounds. Good eyesight for distance and reading, awareness of any problems with color vision, good communication skills, oral and written both. You got to be pleasant, sincere, cooperative, and resourceful. Okay. Professional appearance inspires confidence. You need to be a self-starter, emotionally stable. Um, I always kind of laugh at that, emotionally stable, because you may go into EMS being emotionally stable and then come out of it being a little bit odd. And yeah. So you need to have the ability to lead, be neat and clean, of good moral character, and respectful of others. So you've got to be in control of your personal habits, controlled in conversation, and the ability to communicate properly. You have to have the ability to listen to others and be non-judgmental and fair. Um, you need to, for your education, you need to make sure that you're up to date on knowledge and skills. You take refresher courses, continuing education courses, conferences, seminars, lectures. There's so much out there that's available. Even right now with online stuff, um, there's so much out there. So there's free um, online classes that you can take. So yeah. Okay, so many EMS rescue operations adopt new procedures and equipment on the basis of research, providing evidence that they are effective. Um, when we talk about research, we'll talk about a little bit more about how EMS research is starting to really take off. So how will you refresh your knowledge and stay current once you're out of the classroom? Again, classes, conferences, lectures, online learning, um, various things. So what qualities would you like to see in an EMT who is caring for you? And how can you come closer to being this kind of EMT? Um, so I want to be able to look at that EMT and be like, yeah, I want them to treat my family, and that's what I want. I want to be somebody who could, somebody when I come up on scene, they're comfortable with me and they have called me to treat their family. So I want to be able to portray that as well. Okay, so where will you become a provider? There are different areas that you can become a provider. There's ambulance services, fire departments, rural wilderness teams, urban and industrial settings, and volunteering. Um, in the industrial setting, you could work as an oil rig, uh, health specialist, either on the ocean or on land. Um, so those are just things that you could possibly do. You could also work in the hospital. Um, it doesn't even have to be in the ER. You could work on the floor or doing various things. Okay. So there's a wide variety of career opportunities for EMTs, including the wilderness, rural wilderness setting. So the National Registry of EMTs, it's a registration for EMRs, EMTs, and advanced EMTs and paramedics who successfully complete the NREMT examinations. It may help in reciprocity, transferring to another state or region, and it depends on whether or not that state is recognized as national registry. And it can be beneficial when applying for employment. So in the state of Missouri, you have to go initially to get your license through NREMT. That's basically the testing process that Missouri has. So you have to go and do their psychomotor skills for the EMT test, and also written test for NREMT. So you have to complete those in Missouri, and then after you've gotten it and you get your license through Missouri, you don't necessarily have to have NREMT anymore. However, my suggestion is to keep it. It makes certifying for your Missouri license easier, because National Registry is a little bit more known, and yeah, it just makes it easier to recertify. So yeah. Quality improvement. This is continuous self-review with the purpose of identifying aspects of the system that require improvement. We develop plans to correct deficiencies and improve performance. Quality improvement is such a big part of EMS, and we do QI on every single call that we do. We do QI when we do education. You know, we do QI on basically everything that we do. Okay. So everyone in the organization has a role, preparing carefully written documentation, becoming involved in the quality process, obtaining feedback from patients and hospital staff, and maintaining your equipment and continuing your education. All of those things go into quality improvement. Most systems will have some type of education based on QI. And basically what that means is when we do QI for calls, we identify things that happen recurrently and frequently. So we base our education on those QI issues. Medical direction. So all patient care is performed under the direction of a medical director. They have the ultimate responsibility for patient care. They oversee our training. They develop treatment protocols. They issue offline medical direction, standing orders, and provide online medical direction. So EMS roles in public health. We talked about this a little bit before. We do injury prevention for geriatric patients, injury prevention for youth, public vaccination programs, and disease surveillance. Research. So this is focused on improving patient outcomes and through evidence-based techniques. There's an evidence-based process where we form a hypothesis, we review literature, and then we evaluate the evidence and adopt the practice if the evidence supports it. Okay. When we do research, again, this is something new to EMS, whereas before we didn't have a lot of paramedics and EMS personnel or EMTs doing the research. It was all other people doing the research. Now you're seeing more and more paramedics and EMTs and managers and instructors. They're all doing the research for our own career and our own service. So it's starting to become more of a thing for career-based research. So So the basics of EMS research. Not all research is created equal. We rely on the scientific method. Exacting and comprehensive studies are both difficult and time-consuming, and we want to obtain an objective opinion. So methods reducing bias. So prospective versus retrospective. We want to look at what could happen versus what did happen. Randomization, control groups, study group similarity. I'm not going to get too deep into this because I could go on and on for days about EMS research or just research in general and how to do it and everything like that. So just know that there are methods, there are types of medical research, case studies, case reports, cohort, concurrent control, case control studies, randomized controls trials, systematic review, and meta-analysis, where we take a look at just basically numbers and how we can change something based on that. So level of evidence designation by the American Heart Association, level 1, 2, 3, 4, 5. Okay. Again, I'm not going to go too deep into it. Just know that there are different levels. And I think your book goes into it a little bit more based on those things. Okay. Yeah, your book goes into it a little bit more. All right, so let's look at some questions to ask when evaluating a study. This is assist in identifying bias or flaws and methodology. So we want to question the research. We want to look at the research and basically say, was this research valid? Did it have any flaws? What was the percentage of the flaws? We want to ask those questions and question the research. Because if we don't question the research, then we just take it as word, and that's not what research is. You have to question that research. Okay. So questions to ask before participating in the EMS research study. What is the title? Who's the principal investigator and primary contact? What is the research question or hypothesis? What are the study's inclusion criteria and exclusion criteria? What EMS data is needed? How will informed consent be handled? If treatment is going to be randomized, how will that happen? What samples will need to be collected? And what are the potential benefits to the patient? What are potential risks to the patient? What institutional review board has approved the study? You have to have some type of review board if you're going to be treating patients with some type of new drug or new procedure or something like that. Has the EMS agency's medical director approved the study, and has the EMS agency's administration approved the study? Okay, so those are all questions to ask before you start in the study. Okay, so special issues. Throughout the course, we'll discuss local issues, administrative issues, the course description, class meeting times, requirements for certification as EMT. Your class is all online currently. They'll be in your specific classroom. There'll be the description, the meeting times, and all of that. Okay, so the ADA has set strict guidelines preserving the rights of Americans with Disabilities Act. If you have issues, if you need some concession or some I can't think of the word, some redesigning of how we do things, then we can do that. You just gotta let me know. Chapter review. Let's talk about that. The EMS system has been developed to provide pre-hospital as well as hospital emergency care. The EMS system includes 911 or another emergency access system, dispatchers, EMTs, hospital. All of these people go into the EMS system. Our responsibilities include safety, patient assessment and care, lifting, moving, and transporting patients, transfer of care, and patient advocacy. So the EMT must have certain personal and physical traits to ensure the ability to do the job. Education, okay, continuing education, refresher training, all of that goes into it. Quality improvement procedures and medical direction are all essential to maintaining our high standards. So things to remember. EMS dates back to the Napoleonic times. Modern EMS standards come from the 60s and 70s and National Emergency Medical Services Systems Act. There's a chain of human resources involved in EMS. Critical decisions are made by each member of the chain. There's certain personnel and physical traits that you should have and help you to be successful as EMS providers. An EMS provider should actively pursue opportunities to improve personal knowledge and abilities as well as the unit's overall quality. So these are questions to consider. I'm not going to go into them or discuss them. I just want you to think about them and think about how they affect our EMS. Okay, so what innovation was introduced in the Korean and Vietnam Wars that is now common in many EMS systems? What are the 4 levels of EMS providers? Requesting orders from a physician by radio is an example of what kind of medical control. And what are your patient, here's some critical thinking. Your patient is hesitant to go to the hospital because she is worried about her dog. What can you do to assist in this situation? And what part of your role as an EMT is this an example of? So how can we help this patient because she's worried about her dog? So is there somebody that can take the dog? Is there a neighbor? Is there a family member that can help with the dog? You know, all of those things. So what part of your role is as an EMT is this an example of? This is an example of caring. You know, taking the time to care about your patient and be smart about how we treat our patients, because taking care of the dog and making sure that the dog is taken care of is taking care of your patient as well. So if you guys have any questions, you can call, email, text me, and I'll be more than happy to answer those questions. Just let me know.